So screening smarter. Now that we know why sleep matters, let's talk about how we can actually screen for it in a way that's fast, validated, and fits inside a real world PT evaluation. So to start with, a common screening that we can utilize is the Insomnia Severity Index. This is a very short, just 7 questions, and it's validated in rehab populations, so perfect for us. It gives us a quick snapshot of how much insomnia is interfering with daily life for an individual. And, I kind of think of an instance where, I would use the ISI, if you will, if I hear a patient kind of mention, I just can't fall asleep at night. I have a hard time. When we look back and reflect on the score, when we add it all up, if we look at a 15 or higher, this kind of should send a flag up for us and start thinking that this person may likely have clinical levels of insomnia, and we should refer those folks out. Moving along, there's the Pittsburgh Sleep Quality Index. This measures overall sleep quality and not just insomnia. This looks over different domains such as duration, sleep latency, sleep efficiency, and it's a bit longer, but it definitely encompasses a good breadth of different qualities of sleep. It's just 19 items. We look at it as kind of the gold standard for looking a little bit deeper into someone's sleep experience. And when we look at some of the studies here, a total score of 5 usually indicates someone has poorer sleep quality, and we may need to refer out to the appropriate providers for that. Moving on, we have the Epworth Sleepiness Scale. This screens for daytime sleepiness. It can be especially useful when you suspect OSA or fatigue-related issues. So, we kind of ask how likely are folks, to snooze off during common situations like watching television, sitting in traffic. We might take this out of our clinical tool belt if a patient comes in and they say, honestly, I'm just exhausted all day. I haven't worked on any of the exercises you gave me because I'm just so tired by the end of the day, even the middle of the day. We might look into, does this person have some sort of sleep disruption that is persevering into the middle of the day? If one of our patients scores a 10 or above on this measure in particular, that's suggestive of excessive sleepiness, and we should investigate further. Lastly, a very easy one that we can utilize in our day-to-day is the stop bang. And this is a super easy go-to for quick screening for sleep apnea. It's just 8 questions, yes or no. We ask about snoring, tiredness, observed apneas. We look at their blood pressure, BMI, other sorts of measures. And, if we're thinking that someone's airway is obstructed or has some sort of cardiopulmonary overlaps, we may, utilize this for those type of populations. For this test in particular, a 3 or more, in particular a 5, depending on where you're looking, are going to be indicative of likely OSA. So just to refer these again, if our screen suggests moderate to severe insomnia, high stop bang, or daytime sleepiness affecting safety, that's a referral red flag for sure. Now, we don't want to diagnose these. We can kind of educate on this is what these findings suggest, but we want to direct them towards their primary care, sleep medicine specialist, behavioral health specialist for further workup, all the while providing them education on how to improve their sleep quality, again, without lending out a formal diagnosis.